So hi, this is Oliver from Olydia Care. Here in our new corporate office in Eden Prairie. I want to talk to you about tax. As you know, you have medication administration records that you have to complete. These are drugs that you administer to the patient, and you have treatment record, and also we have tax. Tax are procedures that are made to maintain the standard and quality of care. They are mandated by the Joint Commission and the CMS, the Center for Medicare and Medicaid Services, and Medicare, naturally for the purpose of Medicare certification. They are very important, and some of them are just a check of the expiration of medications, medication orders, medication reconciliations, and emergency back checks, and many of those areas that are clinical review and mandated. They're also part of what we call a medical record. So that means everything you put there is kept by the agency for the next 5 years and may be requested or requested by any credential organization, including the Minnesota Department of Health. So you put your license on whatever you decide or whatever you put there. And as you see in the language of the text, if you have any problem, any issue, if something is not right or missing or you can't complete the task, you have to contact your care manager as soon as possible. I want to indicate that if you click on top on the client information here on the EMR, you will see the face sheet, you will see the care manager's phone number and the name there. Call, contact immediately. It's critical for you to complete those tasks and to make them accurate. Now we have some problems. We have many of the nurses that just use the task and turn the task completion to 100% just for the purpose of completing a shift and submitting a timesheet, which is dangerous, which is not right. We had a recent review by Medicare, and then we reviewed the tax of some of our very, very able and Minnesota and licensed caregivers, which are licensed by the Board of Nursing. For example, there's a task for the review of the backup folder that has MARS and backup medication administration record, the treatment and care plan, and all that. We have a lot of caregivers, nurses who set that tax as, who sign that tax as 100% complete. A review is showing that the patient doesn't even have an emergency bag, and let alone even the backup folder, the red backup folder that is supposed to be in the emergency bag. And then we have seen that, for example, we have a tax that says every week, once a week, to review the supply, the medical equipment supplies, totally. And it's a full tax. It has been constantly signed by a couple of nurses as complete. And then we got a call saying that, well, everything is finished. The supplies are finished. Well, the tax was supposed to have reviewed, and the instruction on the tax was letting the DME company informing them 7 days before expiration that their supplies are running low. And then we have seen a lot of those all over the company. For example, there's a tax that says you have to review the patient information, address, and the face sheet. And then we have noticed that the patient that have moved and the face sheet, the address has not been updated, and the tax has been signed by our nurses. That's 100% complete. So I just want to say that it's a critical tax. Most of them has to medication safety with their assessment review, with a lot of those areas that are critical to the care. We want you to put your name and your license, attach it to what you're doing, because it will come back to bite you pretty hard if you put something that is not accurate. An open review by Medicare or the Joint Commission, they find out that the information is, we can call it fraudulent, we can call it deceiving, what you put is you knowingly decided to give an inaccurate information just for the purpose of completing a shift and submitting a timesheet. So the care managers will review those tags on a daily basis. They will call you out, and I want you to be aware of that. We are a Medicare certified provider and Joint Commission certified also providers. Our standards are pretty high. So we're going to review that. We're going to sanction those who continuously give inaccurate records of what they're doing. And then we're going to work as hard as we can to make sure that the quality of our care and our systems and our records is within the standards of both the state, the federal government, and the international credentialing organization, which is the Joint Commission. Thank you very much.